Hello everyone, today we're going to learn a new topic, professionally applied topical fluoride agents. In this, mainly we will be talking about three fluoride agents commonly used. One is the sodium fluoride, second is a stannous fluoride, and third is the acidylated phosphate fluoride. So starting off with sodium fluoride, this was first used by Bibi where he conducted a trial using 0.1% sodium fluoride. He used it 3 times a year and saw 33% reduction in the dental caries in the oral cavity of children. Second, this was used by Knudsen where he used 2% sodium fluoride. He used it 4 times in a week for a year. Okay, now we'll see how the 2% sodium fluoride solution is prepared. What you have to do is you take 2 grams of sodium fluoride and you will dissolve it in 100 ml of water, and it is stored in plastic bottle. Now it's made sure that it is stored in a plastic bottle because there are free fluoride ions which are present in the solution. Now there are very high chances this will react with the silica present in the glass containers, thereby producing silicofluoride. Now once this compound is formed, there will not be any free fluoride particles left for it to react with the enamel. That's why we make sure that this prepared solution, 2% sodium fluoride solution, is always stored in a plastic bottle. Now, Knudsen's technique is used mainly at 4 age groups: 3 years, 7 years, 11 years, and 13 years. These are the now it is applied at a 1 week interval. The solution should be kept in contact with the teeth for 3 to 4 minutes, and you should tell the patient to avoid eating after the application for the next 30 minutes. Now there is a effect that you see in this technique that is known as the choking effect. In this, calcium fluoride is formed in great quantity in excess. Now when this excess calcium fluoride is formed, it will cause the reaction between the calcium fluoride and hydroxyapatite stops because the hydroxyapatite crystals are unavailable for the reaction, which forms the effect known as the choking effect. There are the advantages and disadvantages. Advantage is that they are chemically stable, they are non-irritating to the oral tissues, they cause no discoloration, and it has acceptable taste. They are present in different flavors. Whichever the child pleases, they can have that flavor. Now the disadvantage is that you have to come very frequently, because of which it is non-cooperative by some patients. There has to be done 4 visits in a very short time period, so it is not as favored by the patients. Second is the stannous fluoride. Now this is also known as the tin fluoride. In this, the technique is known as Muller's technique. Here 8% stannous fluoride is applied semi-annually, that is every 6 months, twice in a year. In this, 8% stannous fluoride is applied for 4 minutes, and then after that it is reapplied after 15 to 30 seconds. It is always freshly prepared. Why? Because it is chemically unstable and it can easily react with the environment. That's why we prepare it once the patient sits on the dental chair. How do you prepare it? A 0 number gelatin capsule is taken and it is filled with 0.8 grams of powdered stannous fluoride, and this is stored in an airtight container. Just before we apply it on the patient, we will prepare. What is done? We take contents of 1 gelatin capsule and we mix it with 10 ml distilled water in a plastic container. Here, new crystalline product is formed, that is stannous fluoride will react with hydroxyapatite and form stannous trifluorophosphate. This stannous trifluorophosphate will react with the further fluoride and form fluorapatite, which is a very good compound in preventing caries. They have anti-cariogenic properties. The end product that is formed is tin hydroxide. This will get dissolved in the oral cavity and it gives a metallic taste on application. What are the advantages? These are more effective than stannous fluoride and they are only required twice in a year. That is, the patient has to come once every 6 months to get this done. What is the disadvantage? The main disadvantage is that has a disagreeable taste. The patient is not comfortable with that taste which it produces, that metallic taste. The tissue irritation is sometimes seen in patients. Gingival blanching is seen. You will see a white color patch on the gingiva, that is blanching, and the solution can undergo rapid hydrolysis. So we're done with stannous fluoride here. Now we'll move on to the third one, that is APF. This was developed by Brudewold. It was found out that demineralized enamel can take up more fluoride better than the normal enamel. So what he did was that he developed a solution by adding orthophosphoric acid and buffered the solution so that the solution will have a pH of 3. This was done to demineralize the enamel before taking in the fluoride. Now, this APF is present in mainly 3 forms. One is the solution form, one is the gel form, and one is the foam. Okay. What we do is that first we have to clean and isolate the teeth, followed by application of the solution, and you leave it for 4 minutes. The patient is instructed not to eat for the next 30 minutes on application. Now, if we are using the solution can be applied onto the teeth with the help of a cotton or a applicator tip. Gel form can be applied on the teeth with a disposable sponge or a foam tray, and the foam, this is applied like a toothpaste, or it is loaded onto a tray which is inserted into the patient's mouth. Okay, now we'll see how the solution is prepared. For the solution to be prepared, we use 20 grams of sodium fluoride in 1 liter of 0.1 molar orthophosphoric acid and 50% of hydrochloric acid. This is buffered to a pH of 3.0. Alright, now if we want the preparation to be happening in a gel form, what do is that we add methyl cellulose or hydroxymethyl cellulose to this, and we buffer it to a pH of 4.5. What are the 2 advantages? Advantages is that you only have to come twice in a year, and you can also do self application of the gel in when the patient is uncomfortable or not cooperative. Disadvantages, there is an increased chair side time. It is acidic, sour or bitter, and it cannot be stored in a glass container.